back to my channel BioQuest Biochemistry classes. Today I am back with a video on glycogen storage disorders. Now what are glycogen storage disorders? Glycogen storage disorders are a group of inherited disorders that are associated with defects in glycogen metabolism. Now we will discuss this glycogen storage disorder by a case presentation. This has come many times as a repeat as long as a question in theory exam as well as a chart or card in the Viva Voce exam. Now let us look at this clinical scenario. A 5-month-old baby was brought to the pediatrics OPD with chief complaints of drilling sensation and increase in abdominal girth. On examination, plasma glucose was 36 mg/cent and serum uric acid was 9.8 mg/cent or 9.8 mg/dL. Plasma glucose did not rise even after glucagon injection. What is your provisional diagnosis? Now, this is a classical presentation of von Gierke disease. Von Gierke disease is also known as type 1 glycogen storage disorder. And why do it occur? It occurs due to deficiency of the enzyme glucose 6-phosphatase, which is the last enzyme for the catabolism of glucose. Now let us look at the figure which establishes the role of glucose 6-phosphatase in glycogen metabolism. Now we know that glycogenolysis, that is the catabolism of glycogen, mainly take place in the liver and the muscle. But in the muscle, the end product is only glucose 6-phosphate. Why? Because glucose 6-phosphatase is naturally or normally absent in the muscle. Now what will happen in the liver? In the liver, the further catabolism of this glucose 6-phosphate will take place in the endoplasmic reticulum. Let us look at this figure. The glycogen via glycogenolysis will be broken down to glucose 6-phosphate in the cytosol. From the cytosol, the glucose 6-phosphate will enter the endoplasmic reticular membrane by the enzyme glucose 6-phosphate translocase. And in the luminal side of the endoplasmic reticulum, this glucose 6-phosphatase, which is membrane bound enzyme, the enzyme will act on this glucose 6-phosphate and will break it down to free glucose and inorganic phosphate. Now this free glucose will again come down away from the membrane of the endoplasmic reticulum inside the cytosol, and this inorganic phosphate will again be transported out via another transporter. Now there may be 3 defects. First one, where there is deficiency of glucose 6-phosphatase, that will lead to type 1A glycogen storage disorder. If there is defect in the glucose 6-phosphate translocase, if it is absent, that will lead to type 1B glycogen storage disorder. If there is defect in this inorganic transporter, phosphate transporter, that will lead to type 1C glycogen storage disorder. So what we have learned from this figure, there are 3 subtypes of type 1 glycogen storage disorder. Type 1, where there is deficiency of this glucose 6-phosphatase enzyme. Type 1B, where there is defect in this glucose 6-phosphate translocase enzyme, and type 1C, where there is defect in this inorganic phosphate transporter. Now the free glucose will be transported out from the cell and it will enter the circulation via the GLUT2 transporters. So this is a figure which depicts how von Gierke's disease takes place. Another important topic from this is, it is a common catch question, this glucose 6-phosphatase enzyme is the marker enzyme of endoplasmic reticulum. Now, what are the clinical features of the patients of von Gierke disease? They will have doll-like faces, mental retardation and increased in abdominal girth. case presentation which I have showed in the beginning of this video tutorial, there was increase in abdominal GERD. Why? Due to hepatomegaly, due to deposition of glycogen in the hepatocytes which was unused, and that lead to increased size of the liver. Now what were the blood investigations which the case was having? The plasma glucose was low. This is due to fasting hypoglycemia. We all know that glycogen is the reserve material for maintaining the glucose homeostasis. If we are in fasting state, an entire glycogen is utilized after 12 to 18 hours of fasting. But here, since glucose 6-phosphatase enzyme is not there, so glycogen cannot be completely broken down to free glucose, and moreover, we know glucose 6-phosphatase is also a key enzyme for gluconeogenesis. That's why fasting hypoglycemia is a cardinal feature of von Gierke's disease. Next, increased in uric acid concentration in the serum. If you can remember the case presentation, the 5-month-old boy was having serum uric acid concentration 9.8 milligram per deciliter of blood. Why so? Because this glucose 6-phosphate, it is also an important product in the hexose monophosphate shunt or the pentose phosphate pathway. And we know that the ribose 5-phosphate is an important product of pentose phosphate pathway, which will go in further formation of the purine bases, and this increased concentration of purine bases, they will be catabolized to uric acid. Moreover, these patients of von Gierke's disease, they will have lactic acidosis. Why? Because this glucose 6-phosphate, it will enter the glycolysis and it will be broken down to lactic acid. They will have increased concentration of triglyceride and cholesterol in the blood. Why so? Because of increased amount of acetyl-CoA, as glucose 6-phosphate will be broken down to pyruvate, that will go in formation of the acetyl-CoA, and they will have hyperlipidemia. So what are the cardinal clinical features of this patients? They will have doll-like faces, mental retardation, increased in abdominal GERD due to deposition of glycogen in the liver, blood investigation, fasting hypoglycemia, and they will have increased serum uric acid concentration along with the increased amount of lipids in the blood. Now let us look at the chart where we can know the different types of glycogen storage disorder. Type 0, that is due to deficiency of the enzyme glycogen synthase. The typing is done in Roman numbers. Now this is a simple mnemonic to remember the major type of glycogen storage disorder up to type 7. This is VP, consumes apple, mangoes and herbal tea. V for von Gierke's disease, P for Pom's disease, C for Core's disease, apples A for Anderson's, mangoes M for McArdle's, herbals H for Her's disease, and teas T for Tarry's. So these are the diseases. Von Gierke's disease, you know, it is mainly due to the deficiency of glucose 6-phosphatase. Pom's disease, I have already mentioned, it is due to the deficiency of acid maltase in my video of glycogenolysis. If you want to check that video, I have provided the link in the I button or in the description box. Core's disease, it is due to the deficiency of deep branching enzyme. Anderson's, this is due to the deficiency of the branching enzyme. McArdle's, it is due to the deficiency of muscle phosphorylase. Her's, that is due to the deficiency of the hepatic phosphorylase. There is also type 8, type 9 and type 10. Type 9 and type 10, they are very rare. There is one important syndrome that is known as Fanconi-Bickel syndrome. That is the type 11 glycogen storage disorder, and that is mainly due to the deficiency of the GLUT2 transporter. This has come as an MCQ in last year NEET PG exam. You can check it out. So these are the major type of glycogen storage disorder. If you like the video and if you appreciate it, do like, share and subscribe. and stay tuned for next videos. Thank you for watching.